I'm with Dvir Dimri from Rescues Without Borders. Now, you've just been to Turkey recently. Tell us what you've seen there.
It's very hard to describe what I have been seeing. It was very, very tough situation. We landed like 17 hours after the collapse, after the earthquake, and it was so close to the disaster. And once we landed at Istanbul, the local police took us and put us on a plane to Adıyaman. Adıyaman, one of the cities that got the earthquake. We landed in Adıyaman. Then they gave us a van with 2 soldiers and 2 policemen. And they took us to the city hall. And near to the city hall, we saw so much mess, a lot of people running, shouting, screaming, crying. All over we saw buildings that collapse and the people that try to dig and to look for their beloved. And we put all our stuff there and we start to dig in one of the houses, the closest houses there. Then, after a 3 very, very complicated hour, we succeed to get 3 people out of the building. One of them, unfortunately, body was dead, a woman, pregnant woman. When we start to dig, one of the people already hear the people still try to scream and to call us to help. After this morning, the local police asked us to go to the hospital. We have with us Dr. Amin Ziad, he's an emergency doctor, and a couple paramedics. And we went to the local hospital. Once we arrived to the local hospital, I cannot describe it was a very hard situation, very tough situation. People came with a truck and gave us people like, you need to decide if take the body to the dead room or to start CPR. I can say that around me had like 6-7 CPR together. And we did the best we can to save life, actually with a lot of success. And we got the people that was like 60, 70, 80 hours around the building. And we give them all what needed to save their life. We cut the clothes, we gave them like medicine, we send them to X-ray. And then all the cast, and other surgeries that should be done to save their life. And actually, we work like around clock all the time. We go to do nap 1 hour, 2 hours, and run back. It was divided to the red zone, yellow zone, no green zone. And all the time we were there. Once the ambulance give you people, or actually people that took the dig, find people and put with us. And all that days, we work very hard to save the life, to give the treatment that needed. I can say that they have enough medicine, no any problem with medicine, like all what we need to the CPR, adrenaline, or unconscious medicine like ketamine and stuff like that, Dormicum, all the saline and other paracetamol. We had enough from that, and not problem with that. But we need hand to work. And after 72 hours, we little bit breath and start to do the second treatment, meaning people that come back with infection, with stuff that we could take care at the beginning. Now we can do it again and to look over and to try to give a better treatment to the people. Then the army took over the airport, the Adıyaman airport, and a lot of helicopters and Turkish airline. And they start to do like air train, like the people or staff to Istanbul, to Ankara. And with the helicopters, they took a patient to another city. And then we also can rethinking what needed, like do reassessment to all the hospital, to all the patient. And then we brought couple specific doctors, like neurology and cardiovascular surgery, and another specific doctors that in contact with the manager of the hospital, we understand what needed, and then we call to our network. SSF Rescue Without Border has a huge network of doctors networks, and we had like a lot of applications that the doctors that would like to come, and then we dig the specifics that we need, because what they coordinate with the local hospital, the manager of the hospital. And then after 72 hours, when we don't need any more paramedics, we need like surgery, and we brought that people.
Are the hospitals overwhelmed at the moment?
Yeah, overwhelming all over. And this moment is you need to be very with ability to work under pressure, to understand what should be done now, because no one would tell you, you go to there, you go to there. Now it's not like it's mess, it's disaster.
Yeah.
And you need to decide it. Like I can tell you that after 24 hours, I went in any place at the hospital and I saw a woman that she told me to take off her veneflon, the IV. They said, okay, it's not comfortable, take it out. I said, okay, hold on, I will take care of you. So I did the full check with breathing, with everything, and I see that something not work well. A little bit fever and bradypnea, tachypnea. So I start to understand what's going on. She looked like calm and talk with me. And after I finished, I saw that her leg, she says that the shoulder pain, I say, okay, it's not shoulders pain. So shoulders pain, fine, it's not what I see. And then I realized that her leg, she has to get the antibiotic IV because she has infection in her leg. And this is something that, no one told me, go to this woman and check her and see that everything okay. But this is what you need, to open your eyes and your mind. And this is what we are training in Rescue Without Border again and again, how to deal and how to work in tough situation and how to succeed, to don't miss anything, not people, not situation, and how to deal in that tough situation.
When you got there, do you see destruction everywhere as far as the eye can see?
Yeah, you once we landed, we start to drive into the city. You wait that it's come, and then you see the first electricity that fail. So okay, fine, it's only the beginning. And then you see the first small house towns that fail, and then building, and then you see all the street. And also I can show you picture, but also the buildings that not actually fail was with a lot of crack, and you see that like almost fail. So no one could come back to there. And you see that I can tell you that in the second day, we come back for a couple hours to dig, and we come to one place, and you see that one of what we train in Rescue Without Border is also how to guide the people that's there. We don't need to bring with us truck or tractors. But when we were there, our people tell to the tractor driver how to dig, where to dig, because he like work here when he should work in couple meter inside the site. So this was also what we did, and what I start to say, that at that situation, another bus with a lot of rescue team from another country cross, and the local people like jump into the road, close the road, and start to almost crash the bus because they would like to take off the rescue team and tell them, dig here, because here I hear someone she scream, I hear my mom, stop the bus, go out of the bus, start to dig, my mom is here, she's still alive.
Out of desperation, isn't it?
Yeah.
Yeah.
And you know that you need to choose, I dig here or here. You don't know where is the better chance. So you can, and it's hard. And this is very, very tough situation. I can tell you one very small story with a lot of hope, that one of our paramedic helped to a woman to do labor, to give a birth. And after a couple of hours, the hospital told her, okay, fine, go home. No one stay here more than 2 hours. I say, okay, fine, but you don't have a home to come back to. So we took her to our tent with a lot of, we give her, one of the paramedics give her $200. For them is 2 months salary. And also he took care, because he has a factory in Turkish, so he took care of her to find her a place. And she told us that she named the baby Furkan. Furkan in Turkish meaning helpfulness. And she wants to thank us, the Israelis, the Legions, the Rescue Without Border team, to help her in her birth and all what we did for her. So she decided to name the baby Furkan.
Is it dangerous for you being there? Because obviously there's been aftershock earthquakes, and also some of these buildings are probably badly damaged that they could fall down around you.
Yeah, it was definitely dangerous because what you said, that we didn't sleep like in the hospital. We sleep a tent like -4 degrees. And not only that, but also so much illnesses that going outside, that going around. And you take care about so many people. We don't have time like to clean between one patient to one patient or to switch glove or stuff like that. They don't actually has like septal or alcohol stuff to clean. They don't, I don't know why, but they don't work with that stuff. So it was very, very dangerous for us. And the earthquake side and the healthness side, it was very, very tough situation. And I can say that not all the time we actually feel safe. And because, also you are in area that got so a tough situation and this disaster and all the bad word together. So at these places, you have like people that got crazy. I can tell you that one of the bodies that we took out of the building, so the father, 70 years old, and another of his son, like 40 years old, big man, like strong, start to hit us, like, and fight. It's not something specific for us, but he would like to go to the body. He would like to take the body. And you can imagine how complicated it is to take it on stretcher, take it off, and put it in the ambulance. And you walk like it's not like regular. And this start to take it, and you like try to hold it, and he like fight with you. And also you see that the policemen, the Turkish policemen didn't feel safe because they say, okay, the civilian there say you are not come to help us, and start to fight and screwing, and so it's not was safe. Is never safe at this situation. No water, no sore, so it's hard situation.
Were the people there, the local people, happy to see an Israeli team come to help and rescue?
Yeah. So they was very, very helpful. I can say that it was one indicated someone come us and tell us bad stuff and terrorism and stuff like that, but it's very, very, small. It's not actually something that we met. We met good people. We met the doctor and other people that came, give us a hug, and say we're so thankful that you are the first people from all over the world, like 8 million people in Israel, and you are the people that brought more than 500 rescue team people to here, like imagine like 400 million people of United States brought 800. We brought 500. And actually the fast, 17 hours, it's meaning that I was at work that day on Sunday, and, I stop everything, run home, pack in like 15 minutes, and run to the Ben Gurion airport. So it was very, very fast. And they know how to thanks about that and be grateful for that.
Did you rescue many people alive? And what does it feel like when you actually get someone alive out of the rubble?
It's great. It's great. You feel that you actually save a life. I can tell you that also at the hospital, you save more life because, they bring you a lot of people, and I can tell you that one of the women, after 80 hours under the ground, she came to us, and we started to do give her all what needed, the glucose and another treatment she need to get. And after 2 hours or so, she fell and crashed, and we start CPR. And we say, oh my, 80 hours she survived, and now she going to die at hospital. So we actually fight on her life and adrenaline and all what we can do. And actually, after 20 minutes of CPR, she come back to life. And as much as I know, she survived. So this is a great feeling.
How do you deal with some of the things that you've seen coming back here now to Israel?
I can say that it's not even close or to all what I saw so far. I work in the rescue team and the paramedic staff like more than 20 years in Israeli tough situation like terror attack, like car accident, and also I went with Rescue Without Border to couple another places like Surfside, Miami Beach. If you remember, 2 years ago, year and a half ago, the one building collapsed. But I can say nothing is close even to the disasters that we saw.
Wow.
And here in Israel, they have a lot of social team and that work with us on trauma and how to process the situation, to talk on them, to work and to deal with that. So this also the very, very knowledge about that area. And the Rescue Without Border work with us and this aspect also. And they take care that everyone that go over this situation could continue his life, like that is take care about that trauma stuff.
Is this Israel being a light to the nations?
I can say, yeah, you definitely feel it. I can show you so many like WhatsApp with doctors there that say, I would never forget it for you. He WhatsApped me, the Turkish nation would never, this one of the doctors there, say, from now on, I will remember you when Israel is mentioned. I love the country of Israel, and the Israel is more because of you. The Turkish nation will never forget this noble act you showed. You have a very big heart, my brother. This is
a Turkish doctor?
Yeah, Berk.
Yeah.
He tweeted, and he all over. He was in interviews there. I can show you his Berk doing like the doctor Berk. Yeah. He doing an interview to a Turkish channel. Yeah. See, he tweet this us together. Yeah, and it's one example. I can give you like here's 7 example. Yeah. One people stopped me, and they was very rash. They say thank you. I said, okay, thank you. Okay, I have to run to work. Yeah. And after he saw me again, he stopped me again. He said, and he didn't know English, and he come with his phone like Google Translate Turkish Hebrew, and he showed me, and it was very, very important to him to show me. He wrote, "Thank you to save my mother." And we took a picture together, and so all of them was, he came to me a couple times before the X-ray, after the X-ray, and asked me what's going on, and I help him also how to deal with that. Not, as I told you, not only now when everything is emergency, because she need the surgery. Not now, okay, it could wait 1-2 days, but so I give them like the direction to come back to ask for surgery, and that. So it was, I have a lot of like picture here, like say, Shukran SSF, like in Arabic, a lot of here, all the doctors.
And you do all this as a volunteer?
Yeah. Very nice. People was very touched. This is with Furkan. This is the mom of Furkan that I told you. And everything is volunteering. All our work is volunteering. We're paramedics with a lot of training and course. And we need to give, let's say, like more than 20 hours a month, much more in volunteering, at least to keep our ability. And all the time, you have new technique and new medicine you need to understand and learn and all keep update all the time. Because we are keeping update and practice, we have the ability to come to new area, land that we never been, with the minimum connections there. Because, no one has, like with the disaster, no one can say, okay, fine, who would like to come and coordinate everything? Nothing coordinate. You need to come and act, and find the way to do the different. And this is what we practice all the time. And yes, I'm developer here. I have an equity fund in real estate, something that you can imagine that is not something that I can blow up for months or weeks or so, but save a life is before everything. So actually, at the same day, I sign up about a new building that I bought in Jerusalem. And, the sign should be like in 4:00. And I show up on 1 to the lawyer, and I give him the check. And I say, okay, this is the check. I sign you here on notes that all what you would like and all what to my lawyer and the other side lawyer, whenever you would like, it's fine. I sign and say, okay, this is with you. Here is the check. I run because I have to get my plan. And, when I come back, all the paperwork, we'll do it later. And it was like, they was shocked. And of course, I understand the situation. But, they could say also, okay, fine, he didn't come, he's not helped me this check. So he didn't come to sign it. I could lose that deal. Yeah. Deal that I work more than half year on it. But they understand it. So we came and this week we did we complete all the paperwork.
Wow. If people would like to give, what is your website for people who'd like to know more?
This is the website, hatzala.org.il. You can see there's so many stuff, people that would like to donate, because now we continue and we start to work on the humanitarian stuff, meaning our team now, we start with paramedic and rescue team, then specific doctors. Now is people that know how to deal with all the humanitarian stuff, and they know how to go to Hatay area, to Adi Yaman area, and to bring the people, diapers, hygienic stuff, clothes, shoes, food, because this is people without home, don't have time to run away. So we don't just doing the rescue, we do all over. Whenever we can help people to live his life better, this is what we are doing.
Okay, Dvir, thank you very much.
Thank you.